So I know a lot of people are wondering if you get the vaccine, will you need to quarantine directly after receiving it?
We don't think you need to quarantine just for getting the vaccine. At this point, we would recommend that isolation or quarantine that we talked about earlier in this program. If you were sick, you had symptoms from an exposure to COVID, or if you were confirmed to have COVID, then the CDC would follow those recommendations. But simply getting the vaccine itself, we expect some mild side effects, and we don't recommend quarantining from just receiving the vaccine if you're otherwise feeling well.
So we've heard a lot about herd immunity. So could you explain the difference between getting the virus and getting vaccinated and how that impacts your future immunity?
I think sort of the long-term effects of the vaccine as we know it and of getting the illness are pretty similar. Once your body has been exposed to a virus like the COVID virus, the next time you get it, your body is more able to fight it off because it recognizes it as foreign, and you have developed antibodies to fight off the infection. The proteins on the virus is what your body builds immunity to. What we think so far is that the vaccine actually gives you better immunity without you getting sick. And we also think that the vaccines, these two that we've talked about, give you longer immunity than getting sick. So they both, either the vaccine or getting COVID in a traditional way from your friends, that you kind of end up in the same place where you are better able to fight it off next time. But we think that the vaccine gives you protection for longer and without the risk of getting profoundly sick from COVID. Something I'll just add here is the sort of amazing science of these two miracle vaccines that are just now approved is that you actually don't get the virus injected into you, or you don't get the virus chewed up into small pieces injected into you. What you get is mRNA from the virus so that your body makes the spikes or the spike protein that's on the outside of COVID. So your body then recognizes the spikes as foreign. So it's using the body's own mechanisms to get ready to fight off the virus without really having the risk of getting sick. You can have some side effects from the vaccine, like some muscle aches or some pain at the injection site, but you don't run the risk of getting COVID from the vaccine. I think you had asked that as well.
Once you get the vaccine, does that just mean you can rip off your mask, go into a restaurant and be like, well, guess what? I got the vaccine, so I don't need a mask. Like, what does this entail once you get that?
I think what we know with the vaccine right now, I may have said this a few minutes ago, but what we know, if I get the vaccine, I am 95% assured that when I get exposed to COVID, I will not have a severe illness. That's what we know. What we don't know is if I get the vaccine now and 2 months from now I get exposed to somebody who has COVID, does it mean that I can't transmit it to other people? I don't think we know that yet. I think we know that when I get it, I'm not very likely, like we said, 95% of the time, to have a significant illness with it. But we don't know, does that change the way that I could spread it? Could I be an asymptomatic carrier for a period of time? Could I give it to my wife and my kids or other people? I don't think we know that yet. I think those studies are still coming, and we'll know more in a few months. So to answer your question, don't go crazy. I got vaccinated. I don't have to do any of this anymore, because I think we still need to be mindful and not spread it to other people. But it's very tempting to say, I'm done. I don't ever have to wear a mask again.
I think even though there are those of us, and I think Dr. Bramwell has already received the first of his 2 Pfizer vaccination injections, even though there are those of us who will be vaccinated before others, I don't think the behaviors, at least responsibly, of those vaccinated will or should change. I think that we'll start to see behaviors change when we see that the numbers of COVID cases in our communities drastically decline and continue to decline. And as those numbers decline, we're going to have that liberty and that luxury of easing up. But I've got my mask on here. I considered it leaving it off earlier, but I left it on because so much of what we talk about is masks these days. And even those of us who are vaccinated along the way will still be practicing these precautions if we're responsible until our greater community, be it Ada County, be it Southern Idaho, be it the state of Idaho, be it the United States of America, be it North America, define your community how you choose. But when we see the numbers in our community diminishing and continue to diminish, that's when I think you'll see things like this finally start to ease up. And again, not that this should be all doom and gloom. We don't want it to be that way. We are going to get to the other side of this. We don't know when, but the how is, unfortunately, people are going to get ill. And fortunately, a lot of people are going to choose to be vaccinated. And that's going to be the way we get to the other side, just as throughout our history. That's the way we get to the other side of viral pandemics. We're going to get there. Keep the faith. And in the meantime, keep doing the right things.